welcome to this committee, and I have to say you do fill big footsteps, and we all look forward to working with you. As former chair of this committee, I can tell you it will be one of the most satisfying things you do in your career. So delighted that you have that position, and again, welcome Senator Levin as well to a committee that I think you will really enjoy. Mr. Chairman, first I just want to say thank you for putting mental health care at the top of your agenda. I think that's really important. As the top Democrat on the Senate's Health Committee and a proud daughter of a World War II veteran, I know how important this is for all of the men and women who returned from war. This is a deeply personal issue to me, so I really appreciate your putting that at the top. I want to turn my attention quickly to an issue that is impacting our veterans that has not attracted as much attention but is really important. As many of you know, under current law, veterans who are expecting a child are eligible to have that care covered by the VA. And in some cases, when there is an emergency, the veteran and the newborn may need to be transferred to, often by helicopter, by the way, to a hospital that can provide a higher level of care. However, as I have explained to this committee before, we've heard anecdotal reports from veterans that the VA is refusing to pay the cost of transporting those newborns or their parents to a more advanced facility and leaving those veterans stuck with thousands of dollars in surprise bills, all in defiance of a clearly stated law. The VA has refused to pay for these expenses, even though that's not what the law says. And since I first brought this issue to the attention of this committee, we can only assume there are other veterans who have received this kind of treatment. So I'm offering my proposal today, the VA Newborn Emergency Treatment Act, as an amendment to make very clear that it is Congress' intent in the law to make sure that veterans and their newborns are getting the care that they need, accessing the benefits that our veterans earned, and being treated with the dignity that they deserve. So I hope all of my colleagues will join me in supporting this important and necessary fix, because I firmly believe that Congress has to ensure that no veteran ever faces a surprise bill for care they earned through their sacrifice to this country, especially new moms and their babies who are dealing with an emergency situation.